You're watching our special show here as we discuss the fine print of the health policy that's been unveiled by the government. Joining us to discuss that, Naresh Trehan of Medanta, Kiran Mazumdar-Shaw, Chairperson and Managing Director Biocon, and healthcare activist Ashok Agarwal. Also with us, our resident healthcare expert Archana Shukla. Dr. Trehan, let me come to you now. I mean, this is undoubtedly a step in the right direction. We can argue and quibble about whether healthcare spending to 2.5% over the next 8 years is significant. And is it enough, especially when you compare us to other emerging market economies and, of course, forget the developed markets. But what was it that you would like now the government to focus on as it starts to roll out this new healthcare policy?
See, off the bat, it's a very welcome move from the government that at least a comprehensive document has come dealing with several aspects of healthcare of a nation. So on one hand, you're saying we want to increase our budget, albeit very slowly. I would be happier if we said that the budget would actually double in the next 3 to 5 years, or maybe 3 years would be the right time. Secondly, it's saying assuring health for all in our country, which is definitely a goal which every citizen would want to see. So I think those twin objectives are very good. Now, how do we go about accomplishing them is to then deal with the situation of, one, how are we going to roll out the insurance policy? Because BPL families need some insurance coverage for sure. It was discussed in the last, in fact, presented in the last budget, not this budget, the budget before that, that there will be a 1 lakh coverage for each family per year. That we thought was a very good and financially viable move, because even the private sector was prepared to accept that those kind of premiums for the services that they were going to offer, so that even tertiary care would be available to the BPL families, which would be a great move forward. The quantum has not been declared in this policy. The other thing is, when you deal with the fact that we want to decrease the disease burden, which is the fundamental right of every citizen and also the fundamental of building this block forward, any amount of budget will not be enough for India unless we decrease our disease burden, and that will only come from our ability to provide those basic hygiene factors, that 5 we talk about all the time, and trying to decrease the chronic diseases that are still pervasive in India, like we said, TB, leprosy, and Kala-Azar. All these things are still there. Now, if we eliminate them, we would be eliminating a lot of demand on our current budget.
Dr. Trehan,
secondly, what? Yeah.
Dr. Trehan, the point that you are making about eliminating diseases and the health expenditure, I just wanted to bring in a point a question that, versus the achievable limits that the government has and the targets that they have set for themselves, do you think the budget that they've allocated would still not be enough to achieve the targets? They're talking about eliminating tuberculosis by 2025. Now, that's a huge target if we look at the current healthcare infrastructure in the country and the disease burden.
Archana, it's the basic thing is, money is not everything. The way you actually utilize the money, the bang for the bucks that you're going to get, is the key here. Now, one big gap that has stayed is the involvement of all the 3 segments of society that are in the healthcare delivery system: the government, the private sector, and the NGO. We are not aligned with each other. There are thick silos. We are in silos. We don't communicate with each other. We blame each other. This policy should actually promote that eliminating barriers. Let's all 3 of us get together and improve the delivery system today. You can get 50% more health today without spending even a penny if we were aligned. You don't have to. There are areas which are overcrowded. There are areas which have excess capacity. There are areas in the private sector also which can offer. But the basic thing is that we need to actually have them incorporated on a PPP platform. The other essential is that what the private sector is suffering from is the fact that whenever we offer or we do the services for government schemes, often we are not paid for long periods of time. And some of us can tolerate it, but some of the smaller hospitals are actually being crushed under the burden of the receivables that are they're supposed to get from schemes
let me
like
just take
CGHS.
that point forward then
there are
with,
correct course corrections to be
Kiran,
made.
Dr. Rehan.
But overall, let
Corrections
me
to be
put
made,
it
and
that
speak.
it is a very welcome move.
Yeah.
Very welcome move, and also the private sector will come on board most definitely as this scheme is rolled out.
Oh, I don't think anyone's disputing that at all. Kiran, Dr. Rehan, they're talking about breaking down these silos between the government, the private sector, and the social sector. Every budget we talk about and industry demands, the healthcare industry demands infrastructure status. It hasn't happened so far, but as we look at rolling out this policy and as we look at addressing or course correcting on some of the crucial shortages in the Indian healthcare market, what is it that you would now like to see?
So, Shireen, to begin with, I think I really welcome this important development to announce such an important national healthcare policy. And I think I completely agree with Naresh when he says that we need to make sure that we are all aligned in optimizing our resources and objectives when it comes to healthcare delivery. Like I just mentioned a little earlier on in discussing with you, we need 2 million beds. That's the hospital beds. That's the shortage that we are addressing today. That has to come from the private sector investing in creating hospitals. Now, unless you give hospitals an infrastructure status, you are not going to, see these investments coming into hospitals. We know that most hospitals today are financially challenged because you cannot, let hospitals operate on normal sector lending. You have to make sure that you give long-term lending of 15 to 20 years. That's when you get financial stability of hospitals. In terms of job creation, I think hospitals are huge job creators. The healthcare delivery sector itself, if you just use a thumb rule of 3:1 per hospital bed, addressing a 2 million bed shortage will create 6 million jobs, and so on and so forth. I think you need health assistants like ASHA workers and so on and so forth. So it's a huge job creator. This is an important sector where I think we need a very strong PPP policy. And as I completely agree with Naresh, we cannot afford to work in silos. Secondly, I also want to say that we need to use technology in a big way, because we need to leapfrog in terms of, bridging all our deficiencies. And getting medical data on a very accessible data platform is extremely important. Getting real-time monitoring of data is extremely important. And there's lots happening. By the way, there's a lot of innovation happening in healthcare. But we need to make sure that the policy addresses this as well.
Michelle, a great point that you've mentioned, and it's good to hear that, a private sector is talking about breaking the silos, of the government, private sector, as well as the health delivery side, because a lot of times we've seen, the private sector and government not being on the same page as far as healthcare is concerned, particularly on the pricing issue. But at this point in time, I would want to bring in Ashok Agarwal, the health activist, to just understand, the government in this policy has also spoken about regulating the hospitals. They've spoken about setting up a national standards, healthcare standards organization, which would set guidelines and stuff. From your perspective and assessment of the industry right now, of the healthcare delivery mechanism right now, so do you think this is a step in the right direction? And we have always spoken about center and state discoordination as far as healthcare delivery is concerned, because, you have the Clinical Establishments Act, which the center proposes, but it's only 10 states in India that have, kind of adopted it. So how do you see this mechanism? Do you think it's, a step in the right direction? And what could be the challenges here for the government?
You see, in the present state of affairs, when the Sarkari healthcare system is totally in a bad shape, I think it is a welcome step. But you see, it does not itself create any accountability. The whole problem is that the healthcare is a public healthcare is a state subject, and in our country there is no state which is having any legislation, because they are just running away from their responsibility of providing healthcare to the people. What is the need of the hour is that the state subject should be brought in a concurrent list. Then it should be made a fundamental right. And then there should be a national law. Why national law is required? Because there is uneven development in the state. You can see Delhi from different parts of the state, UP, Haryana, Rajasthan, Bengal, Jammu Kashmir, people come to Delhi. Why? Because in those, particularly Bihar, because they don't have a proper adequate medical health care facility in a public system. So they come here. If you have a central law, you can mandate all states that within such and such period, you will create such and such infrastructure, physical infrastructure, faculty, and this and that. Like right to education, you can do this. In fact, if, there is a chapter in the this policy document which says that they will do like it is done in the Right to Education Act. But the more you read, then entire spirit of that fundamental right words has been diluted. So what is needed is the law. You can make a state accountable only by law, not otherwise. So what is needed is these things, that it should be brought to the concurrent list, then a fundamental right and a national law. Unless it is done, you see, the common man position is just like a beggar. For if he needs money, he runs to the office of the Prime Minister, he runs to the office of the Chief Minister, he runs to the office of the NGOs, and he begs like anything. So unless, if you want to ensure dignity of a common man in respect to the healthcare services, I think that it is a need of the hour that the government should make a law in this regard.
A central law is what you're asking for. Dr. N, I'll give you the final words in 10 seconds. You know, we've seen this policy now being unveiled. What, to your mind, is the biggest highlight?
So it's just a beginning. For a long time, we've been discussing universal access to health for everybody, for the last man standing out there. It is a step that has started the process. I think the two main things, the health card, increasing the budget, albeit I think that they should be accelerate the increase in the budget, and also then a very meticulous rollout of this program as fast as possible. We do have the Aadhaar, we do have other entities that we have established.
Yeah.
I think with the bank accounts and all that, with Know Your Customer, you can actually roll it out. Now, how it's rolled out, what proportion will the center and state do, and how the payment mechanisms are made, I think will be the key for a wide-based participation. We need the beds, but today, as I said, I will stress again, the infrastructure that's on the ground is actually half utilized. As much as we may talk about some institutions being overrun by patients. And we must look at it, it's Indian asset, whether the government owns it, or the private sector owns it, or the NGO owns it. It's still Indian asset. And we are Indian asset, must be all integrated together for the benefit of the people. I think that will make the difference.
Absolutely, and we couldn't end on a better note. Dr. N. Kiran, Archana, thanks very, very much for joining us here on the CNBC TV 18 special discussion. We'll be tracking the rollout and the implementation of the National Health Policy. But from all of us here for now, many thanks for watching.